All right. So, welcome back, class. We're here with Sally, who works at Voices of Courage, and we're going to talk today about assessments. Um, so, tell us about why assessments are important to your practice here, and how does it work? I mean, they don't just call and show up at your doorstep, or maybe they do, maybe not your door to your office, but how does the assessment process work, and why is it such an important process?
We start the assessment process with the paperwork that families fill out. The application for therapy service is basically our first assessment, and it just kind of goes through family details. And then we also have them fill out within the first couple of sessions a trauma assessment that's evidence based so that we can get an idea of where the child is at with different symptoms. And we try to repeat that assessment around every 3 months or so, or whenever the child meets a milestone or something's changed, because it gives us an idea of what's changed. I mean, it's a good way to measure progress. It's a good way to measure, um, what's going on and how do I create my treatment plan, different symptoms that are happening. It's a good way to explain to parents what's happening and why certain behaviors are happening.
So, not everybody has the same treatment plan.
No,
So why is
very.
that? Why is that?
Everybody's an individual, even with post-traumatic stress disorder. That criterion might be a little bit different for each child. um, a 3-year-old is not going to have the same treatment plan as a 12-year-old. I mean, that too. So as children develop and change and grow and get older, their goals are going to change.
One of the things I know about assessment is that um, it gives us an opportunity to do some, especially with kids, some developmental education. Parents who are complaining that their 5-year-old is whining, and in my head, I'm like, what 5-year-old doesn't whine? So you get that assessment from the parent of the whiny 5-year-old. It gives you that opportunity to say to a parent, that sounds like some normal 5-year-old behaviors, maybe for an abnormal situation, right?
Yes.
So someone who's 5 that was, in a tornado or a car wreck or witnessed domestic violence, not all of their responses are going to be the same. So how important it is in the assessment as you form that alliance, right, and you're working ethically to really understand their view of the world. And you can't do that without an assessment.
Right.
So, do assessments ever stop once you start with a client, or is it always ongoing?
I'm always assessing my client ongoing for family situations, for doing a informal screening in my head of, are they showing symptoms of depression or anxiety, or do I need to do a risk assessment for behaviors, or a suicide assessment, or different things like that. And
So
always those
you,
informal questions are being
so
asked in my head.
there's certainly the formal assessments when the client is a new client here and they fill out paperwork and you meet them for the first time, you take the social history, you do the trauma assessment. And then what you're trying to say is you're constantly doing an informal assessment every time you meet a client.
Yeah.
So that is really smart. How did you know to do that?
I
Just
think a
because you're
lot
really
of that,
smart.
I think it's somewhat intuitive, but I mean, that's just kind of how I was taught to practice, just constantly reading facial expressions, reading into, like, I wonder why they did that. And, asking, those questions of, wonder what caused that behavior, or things
Yeah.
like that.
That's really smart because assessment never ends.
No.
It's always ongoing. And I meet people that think, well, I did my assessment, now it's time for the next stage. And I'm like, yeah, assessment's never done. So,
Especially with kids. They're always changing.
well, sure. And they're growing and developmentally, growing and maturing. And so,
Developmentally.
yeah.
Grayism.
Yeah, a grayism. Sorry about that. As the students will get to know, half of everything I say is a grayism, so they'll learn to tune me out. So, all right. Well, thank you, Sally. We'll wrap up here. Phase 4. I know in transitioning to your new job here at Johnson County Mental Health, you're going to be on an assessment team, I think.
Mm-hmm.
But um, tell me a little bit about assessments from the hospice angle. One of the things about assessments that students are learning is that some of the practicum sites they're at, they already have an assessment they have to follow. Maybe it's a itemized outline, ask these questions. Maybe it's a form, it's a checklist. So, what is the assessment like? What skills do you use? Um, and I love it. I would love it if everybody did genograms because that's my thing.
Mm.
And I know that many agencies have stopped using those traditional assessment tools. But what is that like in hospice care assessments?
Genograms are vital in the hospice realm because it really helps you to understand what their support system is and what their family structure is like. When it comes to healthcare, we really have to focus on if our patient's able to make decisions, and if not, who's the next person that is able to make it. And we have to look at who's around and what's going on. And that support system will really make or break the treatment plan for somebody.
Oh, yeah, good point.
Same with the young gentleman with his mom abusing his meds. That was an unfortunate situation for him and a poor support system with a father who was uninvolved and a stepfather who removed himself because of the problems. And knowing those dynamics in the home really helped with how can we as a team try and support them and give him the best care. And then you have other families where they have a significant other that they've been with for 17 years but never got married. And you have issues of, well, you're not the spouse, or you're not my parent, or you're my step parent, so I don't have to listen to you when it comes to my loved one's care. And you really have struggle and strife because they're all grieving, but they're grieving at different levels because of the way their families are formed. So being able to come in and learn about what their dynamics are and what their cultures are really helps us to form care.
And you can't do that without the assessment piece.
Absolutely not.
The students are going to hear me say more than a dozen times, assessment begins and never ends, right?
Mm-hmm.
Your fifth time to the house, you might learn something new with a client.
Absolutely.
But take a little bit, I did in-home child welfare work for a very long time, private practice. I know for me, parking my car, I wanted to know who all was in the house as I went in, and I would scan, the driveway, what cars are here, do I know this car? So talk a little bit about the day-to-day assessment when you're going out into the community, into the home.
That can change on a whim. You can have a client that you think you have a great rapport with, that you can walk into that home and have absolutely no issues with. And then you're called out one night and taken to the home where there is trouble going on between your client and their roommate. And you end up in a very unsafe situation that spiraled very quickly, that you had no control of. And that's where you've got to really be aware of what is the company's policy. Do they have something in place? In hospice, we had a code called Dr. Green. And in that situation, I called the office and I said, hey, I need Dr. Green. And what that meant was the office knew to call for police without alerting those around me that I was requesting police assistance as I was no longer safe. So there's always should be a safety plan. And I actually brought that up here to Johnson County Mental Health. And my supervisor was kind of shocked and said, we don't have something like that. And I'm actually going to look into doing something like that.
Yeah, because that day-to-day assessment, there's formal assessments, and then there's day-to-day assessments, and then session-to-session assessments. And number one, not only our client safety, but our own safety. You got to constantly be aware, use your eyes, use your nose, use your ears. You have to use all of those tools in our assessment, although the nose is least likely. And we don't really taste clients, so we don't use our taste buds.
No, let's not do that.
Yeah, let's not do that. All right. Hey class, so welcome back. We're here with Jackie at Rosebrooks, and an integral part of foundation student, as you've heard me talk in class and in a couple other guest lectures, is the value of the assessment. Tell me a little bit about assessments. Why is that an integral part of what you do in your position as a social worker?
Sure. So assessments are really important for me, both in an informal kind of way and a formal way. They act as a guide for conversations to help identify needs, to help identify levels of intervention that might be appropriate, to help the client give the information that's needed or share it in a comfortable setting that's got some parameters to it. And essentially it helps me get what I need to do my job, to help meet their needs of wherever they're at. So some informal ways that I do that would be social history. So anytime I engage with a client, I'm just like, so what's going on? So that's an open-ended question for them to just tell me what is going on or where they're at, and I start from there. So it might get a little more formal as going into a social history of family dynamics and context. We also work really closely with child welfare because there often is child abuse and neglect concurrently with domestic violence in the home. And so all of those pieces are very important. So that goes to my favorite, which is genograms and ecomaps. So genograms and ecomaps are really good ways to help depict what's going on and help assess for dynamics within the family, patterns and things like that. Specifically in domestic violence with Rosebrooks, the lethality assessment protocol is an assessment that I do daily. It helps determine the degree of lethality that a client may, their situation might have, so the degree or risk that they would be killed in their relationship. Safety assessment, so just kind of broadening out that lethality assessment a little bit to include other types of behaviors that an abuser might engage in that are also lethality indicators. The strengths assessment is one that I often go into. It is important to highlight strengths throughout the working relationship and be able to build upon those.
Right.
Yeah. Mini mental health assessments, suicide assessments is very important. Stages of healing is another one. But ultimately, I am looking for material that I can help build upon what they're bringing to the table, what has worked and what doesn't, and going from there.
So, can I ask you a question about the lethality assessment?
Yes.
So, there's that phrase, I never remember it, I'm gonna get it wrong. You're so close to the forest you can't see the trees, or you're so close to the trees you can't see the forest. So, what are clients' response to that assessment when you're exploring whether or not they think that there's potential for a lethal end to the relationship?
Yeah, so the lethality assessment itself is a series of 11 yes or no questions, and it is so first responders, so police, emergency room nurses and doctors, and our hotline uses that scale or that assessment rather to essentially know, based in research, the likelihood that someone's going to be killed, and so it's very important to use that language. It does have the impact of kind of shocking somebody, of taking a step back, because a lot of times these are very sensitive situations.
Yeah, that's not what they really want to hear.
That's not what they want to hear. People tiptoe around it because a lot of survival tactics within these relationships looks like minimization, looks like justification or rationalization to survive. So knowing what we know about how people survive in these relationships, this assessment allows us to say, based on research, people in similar situations have answered yes to the questions that you have answered yes to are likely to be killed by their partner. Some people, depending on comfort level, use the word killed, murdered, hurt worse. Sometimes, depending on how I feel like the conversation is going so far, like I don't want to scare anybody into shutting down or having a trauma response to me. I want them to know that I care about them and I want them to live. And so I might say something like hurt worse or even killed. So I might soften it a little, but it is important that it's very direct.
Absolutely. And I don't think it's a topic that should be avoided. It is just a difficult topic to explore and a difficult topic to hear, but an important topic.
Right.
So, all right. Thank you, class. So, continuing with Erica, one of the backbone of the foundation year at KU is not only wrapping your brain around ethics, understanding, forming an alliance, and that core value of the assessment and how important that is, and how that sets the stage for everything else. So, how do you use assessments here at Restart? And why is that something that's important to you as a social worker?
Okay. We have a lot of assessments we use here depending on which role you have. So clinically, we've got mental health assessments to kind of gauge where that person is in that moment to see how best to intervene at that time. Assessment for mental health also gives us a bigger picture of the person and kind of what they are carrying with them. Using genograms and timelines and eco maps to kind of get a full picture of them in their life, where they've been, patterns, just gathering information and gathering knowledge about that person to help us make better, more informed decisions in our relationship and our work with them. We also have housing assessments that we complete with folks to determine what kind of housing may be best for them, what they may be eligible for. Again, giving a bigger picture of their history of where they've been, what they've been through, and what their needs might be at this time, and how we can help them meet those needs.
Right.
So assessments in general, I feel like are kind of the groundwork and the framework for our determining how we work best with somebody, because it gives us the picture of not just who you are right here, right now, but kind of what have you experienced, where have you been, and then considering any family history or pertinent social relationships or connections that they may have to really determine the best kind of journey to navigate through to get to whatever goals that they're needing to get to.
All right. So, do assessments ever end?
No, they
No.
just change and get updated and adjusted and information added to, but it's never just, I did an assessment and I'm done. It's usually a revisiting every, whatever frequency is needed, to kind of reassess if there's any new needs that have come up, or if we've accomplished something, okay, what's the next thing?
Absolutely.
Yeah.
All right. That's perfect. Thank you.
Thank you.
All right, we're back with Michelle at Truman Hospital, and we're going to cover in this segment the value of assessments. So you get a new referral. They have a new diagnosis of some form of cancer, and they're here at the hospital. So what is your assessment process? Kind of take us through that. What do you do?
So I will review the chart. I'll jot down any items of importance that I see. You know, they mentioned that they have home health or they came from a facility, just bits of pertinent information. And then, you know, I print out the face sheet, which has all the information.
Their demographics and
Right,
stuff.
exactly. And then I'll meet with the patient. I have a set of questions that I ask, and it all revolves around discharge planning. So, you know, do you need help at home? Are you using equipment at home? Do you have any services at home?
Do you live with anyone?
Right,
Do you live by
with
yourself?
anybody, you know.
Do you have transportation?
Exactly. Are you able to access food, medications, mental health issues, any substance abuse issues? And then using those questions or answers, I type up my assessment, which helps guide my discharge plan. So, you know, patient could come in and there may look like I have one type of discharge plan, but as they stay and progress, it may totally evolve into something else.
Right, so the assessment is just always ongoing.
Right.
So even if it's their 5th time here
Mm-hmm.
and you've been following them, you're still needing to do kind of an assessment update because it may change your discharge plan?
Yeah, you know, we go in, we do a reassessment, readmission assessment, and, you know, it could be that the patient was living at home and they were doing so successfully for the last 4 or 5 months, but then, you know, this admission, something's changed and, you know, they're no longer thriving at home or able to live at home. So it's like you said, it's an ongoing process.
Ongoing. So it's fluid and it needs to be flexible.
Right.
So, all right. Well, thanks, Michelle. Appreciate that.
Mm-hmm.
Hey, class. We're continuing with Trevana Alexander, who's a school social worker in the Kansas City School District. And in this segment, we're going to talk about assessments and why they are so important and critical to the work that we do. So, we have standardized assessments, and then we have the on-the-fly assessment, just where you're taking a quick snapshot of the kid, the situation, the classroom, the climate of the classroom. So why are they so critical to the work that we do?
Well, because we have to understand the whole picture, right? Even if we are just taking a snapshot, oftentimes in a school setting, you may get a call from a teacher because a student is dysregulated and is disruptive. Most often, a teacher's request is, hey, this student needs to be referred to some community mental health center. They need medication or they need something, or they have a diagnosis. When in all actuality, we don't know what's happened to that child for them to demonstrate that behavior or feel the way they felt. So engaging the student and doing an assessment is key to understanding the antecedents to the behavior that we saw. Oftentimes, also, assessments are very, very important so that we can have accurate diagnosis when there are diagnosed mental illness or diagnosis to be identified. Oftentimes, when we refer individuals to maybe a community mental health center, they get one snippet of information, which may be from a parent. Providing information, but they don't get other external or collateral context to do a holistic assessment, like from the school, what you're seeing there, maybe from other individuals who may engage with that kid a lot. Without those comprehensive assessments, then you can't really identify an accurate diagnosis. Also, just to identify risk levels. Suicide screening tools and assessments are used frequently in school settings as well to help us understand a student's risk for suicidality and, the lethality of it. We can't just say, oh, that student's not really going to do it. They're just saying that to get out of class. No, having an effective assessment tool to implement it with fidelity is very, very important.
What, off the top of your head, do you know what tool you use for suicide here?
Yeah, so we use the Columbia Suicide Severity Rating Scale, or CSSRS, which is a tool that was developed by a number of people. And I can't remember who right now, but it's a very effective tool to really identify suicide risk. So if an individual answers yes to any of the questions, then it's a high risk that they would are likely to hurt themselves in the near future.
Yeah, so it's pretty critical, and I can see from our last segment when you were talking about your empathy skills, and assessment skills, just I think bridge it all together, which then allows us to really be able to sit down and meet the needs of the client. So without the empathy, you might not get the information. Without the information, you can't really do the treatment.
Yes,
So
you
we have
can't
to
get
really
an
bridge
adequate
these
assessment to identify the appropriate treatment. Absolutely.
So, all right.
Yeah.
Well, thank you.
They have to trust you before they're going to just start speaking with you.
And it's not always a sprint. It's usually a marathon, right?
Oh, absolutely. Slow and long.
So, all right. Thanks, Trevon. Appreciate it.
You're welcome.
Welcome back, class. We're here with Flora again at Rediscover. Like a lot of agencies, agencies have requirements for funding sources, for grants, and other rules within the agency about assessment. Assessment would be great if it was always up to me to be in charge of what an assessment looked like. I'd be straight genogram, echo map, social history, timeline. But I know with a lot of agencies and funders and grants, there's very specific things. We heard in another social worker share that the hospital that they're at is requiring every patient have a suicide assessment, every patient. So what does assessment mean to you here at Rediscover? So.
Okay, so one, is very important in our field because it allows us to just really take a good, clear history, gather a good, clear history of that client's mental, physical health, their environment, and being able to get a good picture of that client's situation or the complexity of their, problems that they may be having, so that we can provide a more effective intervention. And then, you know, as you were saying, it's like we have course requirements that we must follow through Rediscover, Department of Mental Health, who is our guiding, you know, a lead of how we assess clients. So we do a yearly assessment. Sorry, can't speak English.
It's all right.
So you do a yearly
I'm
assessment.
not editing that out. I just leave that in there.
Thanks, guys. So a yearly assessment. Of course, we do an intake at that time, and then we do one yearly, and just to kind of assess where they're at, and it includes, you know, outcomes, kind of like some things that have probably occurred. What have they improved? Of course, our treatment plan is also a part of our assessment, you know, because it helps us determine what goals we met with the client and the things that we still need to continue to work on. And then, of course, like you said, we do the PHQ-9, which is our suicide assessment that we do. And so with particular clients who are more suicidal or have suicidal ideations, let me say, they go on our enhanced care program or process where they have a assessment every 7 days. And so the case manager will go out and do like a comprehensive like suicidal assessment just to ensure, you know, their well-being or their state of being.
I can't say that you and I ever experienced this, but I certainly have experienced it in supervision where I'll ask the social worker, I'm going to just use a child welfare case as an example. I'll ask the social worker a question like, who's the guardian ad litem?
Mm-hmm.
You know, have you spoke to the caseworker? And then if the answer is no, usually I would say to the social worker, sounds like you've got more work to do in the assessment. You don't have all of your information yet. So assessments are ongoing and they are a continual process. What kind of advice do you give to your case management staff about assessments?
Of course, I, you know, express the importance of it. I'm kind of like you. If I could, I would have everyone do a genogram, but I train them how to do the echo map. And so if they don't do anything else, just because that will allow them to really get a good, clear picture of that client in their situation, because oftentimes they get so caught up in just the process of let's get the paperwork done versus really understanding and assessing the client's real need. And so it becomes about, you know, getting A, B, C, D, you know, done in a timely fashion that's required by DMH versus really assessing what are the needs of the client. So if anything else, that's why I'm
All right. Well, perfect. Well, thank you, Flora. Appreciate it. Hey class, welcome back. We're here with Evan at the KU Med Center. We are going to talk this segment about assessments. Evan is in a unique position here at KU Med where that is a huge percentage of what he does, assessing a client. There's usually been a request from a medical floor, medical doctor, there's an order, maybe a nursing request. The patient isn't maybe presenting that they are all right or that they are normal given their circumstances. We heard one of our other video guest lecturers talk about sometimes when you're in a hospital, you know, your baseline behavior is going to change because of the anxiety of being in the hospital and just all of that pressure. So tell my students a little bit about assessments for you.
So first and foremost, assessments never end.
They never end.
The information
Can you
is always.
Can you explain that? What is it? What do you mean by that?
Well, everything is always ever changing. There's never just a right course, a black and white way to view something. It's always abstract and gray. And so you kind of got to go in, and every time you encounter with either the patient, patient's family, or the medical team, anybody who's part of the patient's care team, including the patient, like I said, you're always taking in information to kind of help guide whatever is going on in the treatment. So that's what I mean by that. The assessment is never ending. Things can always change, whether it's for the better, for the worse, or just no really impact at all, but it's still something to appreciate. So that's what I mean by the assessment never ends.
Never ends, all right. Do you use any assessment tools here? Is there anything that that KU brings to the table?
So there's one screening, the Columbia Suicide, the CSSRS, I forget what it all stands for, the Columbia Suicide Screen. That is the one thing, and then the other parts are just basic biopsychosocial. So going through biopsychosocial topics, like the biographical information, the psychological information, so some of their history, how they're functioning. You gotta do a mini status exam, or mental status exam, and then the last one is obviously a social assessment. So assessing their person and environment fit and how that is impacting them.
Right. Interesting note, class, as far as policy and advocacy. I know as a foundation student, you may this semester be in policy, it may be next semester, you may totally be very excited for it, but probably not. However, policy needs to be connected to practice, and Evan is a great example of this. When Evan started here at KU, social workers weren't doing assessments, and he got on a committee to try to point out the fact that clinical social workers are capable of doing assessments. It can be a billed item to Medicaid, to Medicare, to health insurance companies. So so obviously you're doing assessments now. Is that committee still active? Are you still involved in that? Or did you all accomplish what you set out to accomplish and it resolved itself?
So it is ongoing. The specific population is alcohol use and drug abuse, and how that impacts somebody's well-being in terms of readmission rates and also suicide rates and other negative associations with drug and alcohol abuse. So there was an assessment that we did identify that we have been spearheading. The culture of my organization kind of views the social work department, or at least I perceive it this way, as a little bit separate from actual clinical work, which is changing and it's good. So it's still ongoing, and to navigate that, we've actually brought on some nurse practitioners to be in our corner to kind of advocate for this. The specific department is the pain management nurses, who have identified that is a deficit within our system and how we approach patients with those needs. And so developing a way that's evidence-based to better approach them is something that we're working on.
Did you ever imagine you would be knee-deep in policy and practice when you were a foundation student?
No, and I still avoid it.
Still avoid it.
Still avoid it.
Although you do a great job.
Oh, well, thank you. Yeah, because policy impacts practice. At the end of the day, we're always following policy, whether it's our institutional policy or the policy dictated by the state or the policy dictated by the NACW. We're always under that guideline. I think there are gatekeepers, and I forget the word that you always gave to them.
Right.
So we're always impacted by policy.
And that certainly drives assessment, I think.
Oh,
So,
yeah.
Yeah. All right. Well, thanks, Evan. I appreciate that.
Thank you.
Welcome back, class. We're at Children's Mercy here with Sonia Duran. So, Sonia, clients, how do they get referred to the TIES program?
They can get referred through any other agencies, or also self-referred, or any other clients as well.
All right. So a client comes in. So do you do a comprehensive assessment to identify what their needs are? So tell me a little bit about that. How do you assess clients?
We use different tools, and we check for safety, we check for domestic violence, we check for depression, which we also check for mental health. So we use different things.
So just out of curiosity, are the tools something that you lead in a discussion with a client, or are they questionnaires the clients fill out, or both?
I would say both, but I usually do it with the client.
Do it with the client.
Mhm.
So I have to ask, are the tools in Spanish, since you're working with Spanish-speaking clients?
Some of them are.
Some of them are, but some of them aren't.
Some of them are not, but if they are not, then I look for a version in Spanish, or I translate it myself.
Okay, all right. So what is the most important skill that a social worker needs in an assessment, in your opinion?
In my opinion, it would be, well, first having a good rapport with the client, and then I would say respecting the client.
Respecting the client, all right. I think that's an excellent suggestion. So, all right, well, thank you, Sonia, I appreciate it.
Thank you.
Hey class, welcome back. We're with Sonia. We just finished a segment on assessment, and I thought to mention, I'm catching her off guard here, I thought we should also mention Sonia works out in the community, right? You go into the homes. So assessment for you is also assessing the safety of the home, right? Sometimes you go to the home and it's not just your client sitting there, but it might be a family member of hers or her boyfriend or people you don't even know. So you have to constantly assess your environment.
Correct.
So have you had some situations where you maybe didn't feel very safe?
Yes, there have been, I would say, several situations, but that's why it's important that as soon as I park my car, then I start scanning and making sure that everything is safe. I receive several trainings on that from my supervisors, talking about that. Like as soon as we get into the home and then entering the home, we have to always make sure like we are scanning for safety.
I know when I've done in-home work and I pull up to a house and there's 3 cars in the driveway, I'm always curious, who do they belong to? And you go into the house and there's only one adult there, and I'll ask, I noticed there was 3 cars in the driveway. Are those all yours? Who do they belong to? Because there have been times where I thought we were the only ones in the house, and then you hear a noise upstairs, or someone just walks through the living room and you didn't know that you weren't alone. And I know that would always make me feel a little insecure maybe. So I'm going to tag this section with the assessment section because I thought it's important for you all to hear that assessment just isn't the client, while it is, but it's also the environment, where you're going to, where you're working, because not only is it important for your clients to be safe, but it's really important for you to be safe and not put yourself in an unsafe situation. So thank you for letting me catch you off guard on that one, Sonia. Hey class, we're back with Melanie at Truman Medical Center in the Futures program, and we're going to talk this segment about assessments. Why are assessments so critical in the work that you do as a social worker?
I mean, assessments are just kind of the foundation really of a treatment plan, and without a good assessment, it's going to be really hazy where you need to go. More and more, we have fewer and fewer sessions with patients. We don't want to really, waste our time. We want to move forward in a plan, and that's the assessment is how we know to move forward. It's how we know to create a treatment plan that's genuinely going to help a patient, not just fill out paperwork for us. So, for me, the assessment, I'm starting assessment as soon as I meet them. Even building rapport, there's assessment about in there.
Right.
And then I have my own written assessment. We do the Columbia for the Suicidal Risk Assessment, and we do that throughout our treatment. We do the short version for the younger kids, and then we do that at every session. I usually, if they're at lower risk, I do it towards the end just to make sure everything is going okay. But with the older kids, we do it kind of at the beginning.
Right. I too, in private practice, when a client was presenting with a flat affect, I would assess where they were at, and I'd weave it into the narrative of my time. It's not like I'd pull out a form every time and check boxes, because that's becomes sort of impersonal. But I'd weave it into, so last week you mentioned you weren't sleeping well. So how's this week been?
Yeah.
And they say, well, I'm still not sleeping well, or this week's been a little bit better. And so that way you sort of just, you still hit all those high points,
Right.
but you're using it while still building the rapport, as we talked about in the last segment.
Yeah,
So-
absolutely. And for me, it's a part of sitting and talking, or in the sand tray room, part of that play, that we're, I incorporate that in, so it's not, so separate. But it's real important. And then when they do have risk for assessments, we have a separate pathway in our treatment plan where, we are addressing that, where they leave here with a laminated safety plan card. So everyone gets that. Everybody knows what to do if something happens. And this is for kids who don't need, who aren't in an acute crisis.
Right.
They don't need immediate hospitalization. But if there is that level of concern, we include the family. We do include parents and caretakers as much as we can, as much as the child allows to, because definitely a big component is that they have some choice about what is shared, except for, of course, suicide, risk to self, risk to others.
Right.
But-
Absolutely.
Yeah.
So, all right. Well, thank you so much.
Yeah,
I appreciate
absolutely.
it.
Thank you.